Osteoarthritis, Mike, is just wearing away of the joints. At the end of at all joints, we have long bones that connect together. At the end of the long bones, we have cartilage. And cartilage is something like a Teflon pan, which is smooth. It has a very low coefficient of friction, so there's not much friction there. So cartilage starts to wear away, we get osteoarthritis. Most often what people complain about that have osteoarthritis is stiffness, pain in their joints. It can be the lower body, it can be hands, it can be shoulders, it can be the spine, loss of motion, you can have swelling. Joints sometimes even feel warm and just don't want to move. The most common complaints are really pain and stiffness. Looking at a knee model here, and I'm just going to go through the anatomy. This is the femur or the thigh bone. This is the end of the femur, the thigh bone. The tibia is the lower leg bone. The fibula sits on the outside as part of the lower leg as well. So if you look, and we're looking at the joint from the front, and I have removed the kneecap. Okay, the quadricep muscle would sit in the front here. If you look in this joint, at the end of the femur, there's a pristine surface. Okay, that's particular cartilage. We call that hyaline cartilage. So at the end of all of our long bones of the joint, you have hyaline cartilage. And that's supposed to give us a friction-free, or as close to a friction-free surface as you can. At the knee, we also have two menisci, okay? The lateral meniscus and the medial meniscus, but underneath that is cartilage. So the meniscus just helps to save the cartilage from damage. So in a nutshell, that's really arthritis. And arthritis is just, again, wearing of the articular cartilage. Then we start to lose joint space and all the other things that occur.
One winter evening about 2 years ago, I took a different way home and slipped on a 12-foot hill. And when I hit the bottom, my ankle hit a rock, so it bruised that. And my knee just had already been aggravated by arthritis, and it just became so painful I couldn't really walk. When I first came here, they started right away and giving me like cold therapy, just measuring, checking me out, giving me a list of exercises to do, which is something I'd never done before. I'd never done all those kind of physical exercises like they had me do. Exercises were extremely beneficial to me. The stretching exercises, strengthening exercises, not only just in the knee area, but from top to bottom.